Hypertension, or high blood pressure, is a major problem in America today. A combination of factors has led to the increase in cases of hypertension. Americans today are more likely to be obese than they were 20 years ago. The sedentary lifestyle and high fat and sodium intake of the average American are just two factors that contribute to high blood pressure. There is no identifiable primary cause for hypertension. Doctors believe it is due to genetics. However, there are several secondary causes that can be treated. In order to understand hypertension, we must first understand blood pressure readings. There are two numbers in the blood pressure reading. The top number is the systolic pressure. This is the pressure created in the arteries when the heart contracts. The second number, the diastolic pressure, is the pressure created when the heart fills with blood. When you have your blood pressure read, it is important that you relax the arm that is being read, so you do not get an inaccurately high reading. Doctors will not usually diagnose high blood pressure with just one reading. Many factors can cause an inaccurately high reading. Often patients are nervous and tense when at the doctor's office. If the doctor suspects hypertension, he will most likely request that the patient buy a blood pressure cuff and monitor their own pressure over a period of time. This gives the doctor the opportunity to get a long-range view of the patient's blood pressure. What is clinical hypertension? An ideal blood pressure is difficult to define. However, doctors agree that anything above 120/80 is considered elevated blood pressure. Why is it dangerous? Hypertension puts undue strain on the heart. Over time, this strain can lead to heart disease, heart failure and death. Strokes are another risk for patients with high blood pressure. If left untreated, hypertension will eventually affect all the organs in the body. This can shorten life expectancy from 10 to 20 years. What are the treatments for hypertension? While many patients would prefer just being given a prescription and continuing their current lifestyle, this course of action is not ideal. The best way to treat high blood pressure is through lifestyle changes. The patient needs to begin exercising. The popular opinion is that 30 minutes of exercise 3 times a week is enough. If a patient needs to lower his blood pressure, this is probably not enough exercise. Aim for at least 30 minutes 6 days a week. Walking is a great exercise. If you live in an area with cold weather, a treadmill is a wise investment. The second step a patient should take is diet modification. Studies have shown that a diet high in sodium contributes to high blood pressure. Limiting the sodium can help. If diet modification and exercise do not control the problem, medication may be necessary. There are two types of medication commonly prescribed for hypertension. The first type is beta blockers. Beta blockers reduce the amount of blood the heart pumps out, as well as the heart rate. The second type is diuretics, which eliminate unnecessary fluids and sodium in the body. If the hypertension is severe, a series of multiple medications may be necessary to bring the blood pressure to an acceptable level. Michael Russell, Your Independent Guide to Halloween, http://halloween-guide.com/closing square bracket. Article source, https://ezinearticles.com/expert/Michael_Russell/12389. Article source, http://ezinearticles.com/2425516. Subscribe to this channel for more information on your health. Visit the links below to check out my most recommended methods of controlling high blood pressure.